So what are the do's and the don'ts when taking a homeopathic remedy?
Okay, so where a homeopathic remedy is taken is often orally. Right? In a very, very sick individual or in a baby, one could use olfaction as a method, but for all intents and purposes, most remedies are taken orally. So our absorption would occur in the mouth, in the sublingual glands. So your mouth needs to be clean. That's how I try to explain it to my patients. If you've just eaten, it's not a good idea to take your remedy because it can impact on the absorption of the remedy. If you've just brushed your teeth, for example, the toothpaste can cause vasoconstriction and therefore affect the absorption of
also mint specifically, isn't
mint and menthol and coffee and other very strong flavors and products can interfere with the absorption and the efficacy of the remedy. However, when you treat a lot of children and you're dealing with moms who are busy, who also have more than 1 or 2 children, I find that what I say to my patients is that if it's the time for the dose and we've given a 3-hourly dose or a 4-hourly dose, and you think, oh, I don't know if the mouth is clean enough, and oh, let me do something or let me wait. I think by the time you turn around, another 2 hours have passed and you've missed your dose. So as much as we try always to stick to it, I find that sometimes it's not always easiest, and I do understand that. And so I would say rather just take the remedy.
Right.
It will still do its thing.
And then if the child is trying to take the remedy, let's say they're a little bit older, and you tell them you must take 4 and you've shown them how, and they put it in the lid and they have it and it falls on the carpet or the floor.
Yes. I would just do another dose.
You wouldn't take that?
No.
Why not?
Well, remember, a lot of the time your pilules or your granules that you're referring to are medicated. So the actual medication is dropped onto them, and then a little film or a coating is created around that. So if you handle it, or if it drops on the floor, never mind that you can remove that film, but you could also pick up something else. And I think, there's so many doses in a bottle. If you drop a few, rather just take another lot.
And what happens when the child just downs the bottle because they taste so nice? And believe me, my children have gone through cupboards at a time.
I have had many phone calls of parents in absolute panic where they've taken the bottle. It's okay. You've just taken a very large single dose. So
that's correct.
With homeopathy, it's about the repetition of the dose and the timing of that. That's what's more important than how many you take. So often it's not to worry. If they're taking it in lactose granules, they might have a little bit more lactose and sugar, and that would be the extent of it.
Taking 4 or 5 different bottles in mom's cupboard.
All at the same time.
All at the same time.
There's not going to be a major problem that's caused. Again, it would probably be too much sugar. You might have interactions with remedies. If the child is sick and they're taking it, it could interfere with the child's picture, which would maybe make it difficult for the homeopath trying to treat the child. But all of those things can be overcome because the remedy, after that dose subsides, the remedy will show itself and you'll be able to prescribe.